Hi, this is Paul Wise and welcome to the Lawn Vets video series. Today in this short video I'm going to be sharing some information with you about skin disease in dogs and cats. Skin disease in its various forms is the single most common condition for clients presenting their pets to the surgery. Skin disease in both dogs and cats, in the vast majority of cases, has a number of basic causes. These include, for example, 1. Parasites such as fleas, mites, ticks and lice. 2. Allergies such as atopy or food allergy. 3. Endocrinopathies or hormonal problems. 4. Autoimmune problems where your pet's immune system starts to misbehave. And 5. Primary bacterial infections and seborrheic disorders, especially in dogs. Now, the vast majority of skin problems presented at the surgery will either be parasitic or allergic in nature. So how do we go about making a specific diagnosis? History of the problem is very important, so your observations and your pet's medical records can prove to be very revealing. A physical general examination of your pet, and specifically including paws and ears, is extremely useful. But sometimes we need to move on and do skin scrapes, hair plucks, biopsies, blood testing to check for hormonal problems, and an allergy workup in the form of blood testing or intrastomach testing. And lastly, response to trial therapy may all help with diagnosis. Now let's cover some treatment fundamentals. With the exception of certain parasitic problems, in many cases of skin disease, the problem will not be curable, and that therefore we will have to look to control and manage your pet's skin problem. As such, this may require seasonal or all year round treatments. Mandatory parasite control, or more basically the use of a quality flea control product at the recommended interval. Even if your pet has a skin problem that's not caused by fleas, the presence of fleas is likely to make the problem much worse. Good nutrition, or possibly some nutritional supplementation with fatty acids or zinc. More recently I've used aloe vera for this purpose. Controlling primary or secondary bacterial infections, typically using antibacterial shampoos or the judicious use of courses of antibiotics. Anti-inflammatories or the use of anti-itch drugs, of which there are now several options available, and often requires trial therapy to find a product that suits your pet, specifically in the longer term. Immunotherapy. Where we can find out exactly what your pet is allergic to, then it may be possible to produce a special vaccine for your individual pet to try and desensitize them and to try and stop them reacting to it. Food trials. These are not easy to do and require a lot of commitment on your part. We need to find a food that contains a novel single source of carbohydrate and a novel single source of protein. A novel source means something that your pet has never had before. Home-cooked diets are probably the best, but can be time-consuming to prepare. There are some commercially available foods designed for this purpose that can also be used. For the dietary trial to be successful, your pet needs to be fed the special food with water and absolutely nothing else for a period of at least 6 weeks. As always, if having watched this video you have any questions, or if you encounter any difficulties, then please phone or email the surgery. We're here to personally help give you the very best advice and treatment possible for your much loved pet. Thanks for watching. Any feedback regarding this video will be very much appreciated.